Okay, our next section is on syphilis, perinatal infections. Syphilis is caused by a spirochete, is a sexually transmitted disease, and is a very noble disease. It is the disease of kings and queens, of emperors, of empresses, of popes. We'll see some of the people who have been infected with syphilis in just a minute. Here's our case. A 34-year-old multigravida presents for prenatal care in the second trimester. So we have late onset of prenatal care. That's not always good. She admits to past substance abuse, but states she has been clean for 6 months. Well, that's encouraging at least. With her second pregnancy, she delivered a 34-week male neonate who died on day of life number 1. Now, when we get our obstetrical history and we're doing screening for risk factors, one of the things we want to look at is, how did your pregnancy turn out? She delivered at 34 weeks, so preterm delivery, and the baby died on day of life number 1. So the baby died. Why did it die? Whenever I have a neonatal or a fetal death, I always ask the mom, did you see the baby? What did the baby look like? Was the anatomy normal? Did it have arms and legs? Was the abdomen open? Was there a spina bifida? And this woman says that at delivery, the baby was swollen. We call that hydropic. The baby was swollen with skin lesions. The placenta was large, placentamegaly, probably a huge hydropic placenta as well. She was treated but doesn't remember the details, but the prenatal panel now shows positive VDRL. This is a classic finding for congenital syphilis. Congenital syphilis. This looks at famous people speculated to have been infected with syphilis. Pope Alexander VI, Christopher Columbus, King Henry VIII, and most of his wives, Ivan the Terrible, Queen Elizabeth I, Mozart, Paganini, Schubert, Gauguin, Van Gogh, Scott Joplin, Lennon, lots of famous people. And of course, syphilis back then, there was no treatment. It swept across Europe in epidemics. Did Christopher Columbus get it from the New World? Or did he take it to the New World? There's a lot of discussion about that and controversy. Vladimir Lenin, and in Red Square today, he lies in state in Lenin's tomb. Strong suggestion that he died from syphilis. Henry VIII, he had on his leg an ulcer for years that never healed. And when you look at the offspring of Henry, only one survived. That was Bloody Queen Mary of England. We had a baby that died on day of life number 3, day of life 52. Of course, it's only suspicion, but Henry VIII would be certainly a good candidate for this. Syphilis, the residual effect of a primary infection. Is it lifelong immunity or is it lifelong latency? And the answer is neither. Because you can get it, and if it's not treated, it will stay there for a long time. Or you can get it and be treated, and then you don't get it, or you can get reinfected. So it really doesn't fit the category of latency or immunity. The mode of transmission is mucocutaneous contact, similar to herpes, genital herpes. What is the route of vertical transmission? Remember, vertical transmission is from mom to baby. Is it going to be at the time of delivery, or is it transplacental? And the evidence is it is transplacental, and a very high rate of infection. We can have early congenital syphilis, and early congenital syphilis looks like the case that we just had. Hydropic fetus, anemia, high output cardiac failure, macerated skin, and this baby either dies in utero or it dies in the neonatal period. Then there's late onset of congenital syphilis. These babies don't look bad when they're born, but they develop lots of things which I don't see. Pediatricians may see later. Hutchinson's teeth, saber shins, mulberry molars, saddle nose. The delivery mode, even though it is transplacental, vertical transmission, is vaginal. And the reason is because we can treat syphilis very effectively in utero. If on the exam you see a term, macerated hydropic fetus, at least pass through your brain, could this be early congenital syphilis? Non-immune hydrops. Now, immune hydrops is where you have the edema and the ascites, which is mediated by antibodies. We'll talk about that under the section on isoimmunization. But this is non-immune. It's not mediated by antibodies. This is by infection. Macerated skin, thrombocytopenia. Think early congenital syphilis. Now, late congenital syphilis has many of these eponyms: Hutchinson's teeth, mulberry molars, saber shins. Here we have the Hutchinson's teeth. Can you see the notching of the teeth? Here's some more. Fortunately, we don't see this very much anymore. Hutchinson's teeth. This is a baby who has a nasal discharge. This is commonly what you'll see with newborns that are infected with syphilis. The cartilage of the nose can get severely affected. And look at these, what is called the saddle nose. Fortunately, congenital syphilis is declining in the United States, but it is always there, ready to come back. When we look at the classic lesion of primary syphilis, it is the chancre. How many chancres have you seen? We don't see too much primary syphilis. I don't know if I've ever identified a chancre. Secondary syphilis, the primary lesion, is condyloma lata. These are cauliflower-like excrescences which are just streaming with spirochetes. Money spots, I'll show you a picture of that, are where you have disseminated secondary syphilis in the skin. Often the hair can fall out as well. The extent of disease: primary syphilis is localized, secondary syphilis is systemic. In terms of laboratory tests, your primary syphilis, you have the VDRL negative, and the reason it's negative because you don't have time yet for the antibodies to form. The dark field microscopy, however, will show the spirochete. The FDA absorbed would be positive. Secondary syphilis, VDRL is positive, dark field microscopy is positive. They are all positive. The fetal infection rate is very high, regardless if it's primary or secondary. And that's why we have, as a routine prenatal laboratory test, the screening for syphilis. Because most women who have it don't know it, and they have latent syphilis. We owe a great debt of gratitude to Alexander Fleming, who was a Canadian researcher who discovered penicillin. He was a laboratory rat. He liked to work in his lab, wasn't much of a social creature. He had a crust of bread that he left out one day when he hadn't finished quite eating it, and it grew a mold on it. What he noticed was that around where the mold was growing, it suppressed bacterial growth. And that raised his suspicions. Maybe we've got something here that can treat bacteria. In the Civil War of the United States, there were far more soldiers that died from infections than from war wounds. It was the infection. In World War I, the same thing happened. In World War II, by the time the World War started, Alexander Fleming had introduced penicillin and saved the lives of countless soldiers. He got the Nobel Prize in 1944. The treatment of choice in pregnancy: penicillin, Penicillin. How about if the mother is penicillin allergic? Doesn't matter. We want to give penicillin. Penicillin. Okay, let's summarize what we've said. The classic lesion in primary syphilis is the chancre. Secondary syphilis is the condyloma lata. The extent of the disease, localized primary, systemic secondary. The VDRL is negative on primary syphilis because you don't have time for antibodies yet to come. By the time secondary syphilis and it's systemic, all the tests are positive. Fetal infection rate is high regardless of the stage, and the treatment of choice is always, in pregnancy, penicillin. If you have primary syphilis, and if it's not treated, the chancre will go away, and we will see condyloma lata, evidence of systemic disease. Secondary syphilis, in 2/3 of patients who are not treated, becomes latent syphilis. There are no symptoms, no physical findings. All you have is a positive nonspecific test and the treponema-specific test, which are the FTA absorbed, which will be positive. 1/3 of patients who have secondary syphilis, however, will go on to develop tertiary syphilis, and tertiary syphilis is where you start to have the gumas. And they may be in the cardiovascular system, in the central nervous system, in the bone, and depending on where those are, the symptoms can be quite variable. Syphilis has been called the great imitator because it can have cardiovascular symptoms, it can have central nervous symptoms, it can have various ones. And here now, we have not only the blood tests but are positive. If you have a central nervous system involvement, the central or the cerebrospinal fluid will also be positive. And so this needs to be treated for a longer period of time. Here we have a syphilitic chancre. And the characteristic is a raised edge. I don't know if you can see this very well. Raised edge, and it is painless. Here's another syphilitic chancre. Painless. Now this is on the penis, and I know I'm OBGYN, but what this shows is it has this rounded, raised, smooth edge. And that's characteristic for the chancre. A painless, rolled edge genital ulcer, think primary syphilis. Now here we have condyloma lata. This is with secondary syphilis. Here we have chancres. If you have on the exam dark field microscopy positive, think of syphilis. And the reason you can't see the spirochete on a light microscope is because it is so thin that it doesn't show up. With a dark field microscopy, it will. And here is the spirochete, which causes syphilis. Condyloma lata is your classic finding with secondary syphilis. And here you can see these widespread cauliflower-like lesions on the genitals. The FTA absorbed is where you have antibodies against the treponema, and then you have antibodies which are against the antibodies. And these are fluorescent. And the green fluorescent antibodies attached to the treponema antibodies, and they will then result in your FTA absorbed, and you have this positive fluorescence, and it shows up the spirochete. These are called the money spots of secondary syphilis. Money spots. This is a Saber shins. I've never seen this before. That's not something that we see too much anymore. This is your late congenital syphilis. Treatment, and I already alluded to this, in pregnancy, benzathine penicillin. And the reason we don't use other antibiotics is because they cross the placenta very poorly. And our big concern is the fetus. If the mother is allergic, we do acute desensitization. And the serology titers should decrease 4-fold after 3 to 6 months. The treponema-specific tests will remain positive for a long time. Now, what you do with the oral desensitization is you give a very small dose, 100 units. You wait 30 minutes and you double it. You wait 30 minutes and you double and you double and you double, so you go from 100 to 200, 400, 800, and by the time you have gone through 14 successions of this, you have given the 1.2 million units, which is recommended for treatment. And even if the patient is allergic, this is how we can treat this. Now, the Center for Disease Control has what they call the SEE, Syphilis Elimination Effort, a national plan to eliminate syphilis from the United States. And the public health authorities are vigilant in doing case management to identify any patient who has syphilis and their sexual partners. This was an interesting limerick printed originally in the Journal of the American Medical Association. And it's kind of humorous but tragic, but it shows a lot of the common manifestations of syphilis. There was a young man of Black Bay who thought syphilis just went away and felt that a chancre was merely a canker acquired in lascivious play, primary syphilis. And now he got acne vulgaris, the kind that is rampant in Paris. It covered his head from forehead to shin, and now people ask where his hair is. His hair started falling out. Secondary syphilis. His passions are strong as before, but his penis is flaccid and sore. His wife now has tabies and saber-shin babies. She's really worse off than a whore. Tertiary syphilis. He aches from his head to his toes. His sphincters have gone where, who knows? Paroxysmal incontinence, with all its concomitants, brings forth unpredictable flows. Tertiary syphilis. Nothing you want to give to people you love. And that is the end of our section on syphilis.